This podcast is part of the Frederick Podcast Network. Learn more at listenfrederick.com.
That's number one. You kind of reset me.
Painful, tender to the touch. May also
Same shoulder length and the other.
Well, hello and welcome back to another episode of the Real Health Podcast with Brandi and Amir. I'm Dr. Amir Rashidian, a chiropractor. Brandi Rashidian is my other half, co-host, and the, what are you today?
I'm your injured cohort. I feel like
That's
I've had
right.
a rough week.
She has multiple injuries.
Yes.
But at least I didn't raise her blood pressure this week like last week. So the
True.
Real Health Podcast is brought to you by the Frederick Podcast Network. It's found on listenfrederick.com plus YouTube, Spotify, iTunes, iHeartRadio, and everywhere else you like to find your podcasts. And our focus is to bring to you the information about health and wellness. And our goal is to help you feel better, get stronger, live longer, and feel younger. Now, we had promised we were going to have a guest today. We postponed that guest to next week for scheduling purposes, but we may have a surprise guest just pop in. And
We'll
that's
see.
all I'm going to say about that.
We may have some good questions for this guest. See if
that's
they
right.
can help process through some of this.
That's
with
right.
us.
You'll want to stick around till the end for sure. And we don't even know what's going to happen. So we're going to stick around to the end too.
Hopefully.
But today we're going to talk about things that, were considered mainstream and are currently considered less than mainstream,
Yes.
whatever that may mean to you. So there were things that doctors used to do for treatments of certain things, and today we wouldn't consider doing those. And the reason we did this is because I bet you there's a lot of things mainstream medicine does today that in maybe 100 years from now we'll look back and say, I can't believe how barbaric they were.
Oh yeah, I'm sure. I'm sure we're gonna see that.
Yep.
I mean, we may not because we may not be here.
I won't be around 100 years from now.
Yeah, because you're not 20, and you do say you'll be here till 120.
120.
So we'll miss this one.
I got 68 and a half years left.
Woohoo! We'll live it up.
That's right. Or less. I don't care if it's less. I know where I'm going.
Yeah, seriously.
So the first one was actually bloodletting, and some people think that can't be true. It's a myth, but it's actually true.
Yeah, they did it
Basically
for a long
bloodletting.
time, actually.
The treatment that lasted nearly 2,000 years. Historical background: the theory of the four humors was developed by the Greek physician, no one other than Hippocrates. Hippocrates is the Hippocratic oath that every medical doctor has to swear to when they become a doctor, which is first do no harm. Did you know there's a chiropractic oath?
I did actually,
Yeah,
but I don't know how it goes.
And nobody knows how. Nobody knows the other one either. I mean, you say it, you swear to it, and then you move on. So,
That's funny.
but it's similar. Anyways, the chiropractic oath is a good one. We all say that when we graduate from chiropractic school. Anyways, later expanded by Roman physician Galen. This was in the year 129 to 216 AD. So the four humors are blood, phlegm, yellow bile, and black bile. So blood is associated with vitality and optimism, and the personality type is sanguine. Do you know what that means?
No, do you? We're gonna find out. Okay, keep going.
I'll let you figure that out. Phlegm, associated with calmness and passivity. Personality type is phlegmatic.
That's funny. Sanguine is cheerful, optimistic, and social.
Sounds about right.
Mm-hmm. Phlegmatic is calm, steady, and relaxed. How is phlegm associated with calm? I have to understand how.
I don't know, but listen, Hippocrates is not around, neither is Galen. So we're going to have to move on. Yellow bile, thought to be produced by the liver and gallbladder.
And that represents fiery, ambitious, and quick-tempered.
Yes. Yeah.
And then black bile.
Thought to be originated from the spleen, associated with coldness, sadness, fear, pessimism, and depression.
Also thoughtful and serious.
Melancholy comes from the Greek.
Mm-hmm.
Melis is black and chole is bile.
Yeah.
Wow. Very interesting. For nearly 2,000 years, physicians believed disease resulted from imbalances among these humors. And there's a famous story in 1799.
Mm-hmm. It's a while ago.
George Washington himself developed severe epiglottitis. I guess that when the epiglottis gets inflamed, or a throat infection. Physicians removed approximately 80 ounces of blood, which is 40% of his blood volume. Many historians believe blood loss contributed significantly to his death. I wonder if people survived some of this. This was found in the book called The Greatest Benefit to Mankind, A Medical History of Humanity. Sounds like an interesting book.
I'm telling you, it's unbelievable to think that went on for so long.
Yeah.
Um,
Only 2,000 years.
Yeah, and we don't really know how many people survived or did not survive those. There are really no stats for that, unfortunately.
Depends on how much of their blood was drained. I mean,
yeah, it's crazy.
The doctor, I guess, decided we need more blood. Take more. He still looks red, you know.
Well, I'm really glad that is not a regular practice now.
Yeah. Well, here's another one. Mercury, the poison that became medicine.
Oh, step back though. You know what? I wonder if sometimes theology played a part in some of that, because blood, biblically speaking, is such a powerful substance.
Yeah.
Do you know what I mean? And so even in Bible times, if you go back and you read into the Old Testament,
you couldn't touch blood. It was unclean.
Yeah. So I can see where some of that may have been drawn from, sorry.
For centuries, mercury was considered one of medicine's most powerful treatments.
This is unbelievable to me.
Physicians believed they could purge impurities from the body and restore health by forcing the elimination of disease-causing substances. Mercury was commonly prescribed for syphilis, constipation, skin diseases, digestive disorders, parasitic infections, various chronic illnesses. From the 1500s through the early 1900s. Wow.
It's crazy.
Mercury remained a standard part of medical practice throughout Europe and North America. One of the earliest detailed descriptions of mercury-based therapies appear in, it's called De Medicina. The author is Olus Cornelius Celsus. It's a great name for a mercury expert. Celsus. Did he develop the mercury thermometer?
Right.
It was written in approximately 25 AD, so we're talking 2001 years ago.
It's crazy.
Mercury use expanded dramatically after the spread of syphilis throughout Europe in the late 1400s. I bet you they gave them mercury to kill them so they wouldn't spread any more syphilis.
Well, I mean, that is inevitably probably what ended up happening.
Mercury is a neurotoxin. Like, it kills nerves. These people...
Yes. Well, it's funny because it says that when they did these mercury treatments, that the patient would have intense sweating, salivation, diarrhea, and skin reactions. And so the physicians assumed that was the mercury driving these diseases out of the body. And I do believe that in this time frame too, again, spirituality was all tied to this. And so it wasn't, and I don't know how wrong they are in some of that too. I think we've removed all the spiritual instances of how the spiritual realm may influence our health. We've removed that from medicine altogether. That was still somewhat in place during this time frame.
Oh, yeah, for sure.
It's not a surprise to see that they would think this. And you said it was a neurotoxin. So patients often developed tremors, memory loss, irritability, mood disturbances, hallucinations, kidney damage, severe gum disease, tooth loss, neurologic deterioration. Now, here's my question. Are you ready for this? How long after they figured out that mercury did this before they took it out of vaccines? Am I allowed to ask that? That's a very legitimate question,
It's a valid question.
right? So I don't know the answer to that. I don't know at what point they determined that, because I know it hasn't been as long as we think it has to where mercury was removed out of vaccines that were being given to babies and kids.
It's still in some. Thimerosal is mercury.
Yeah. Oof.
All right. Famous saying, a common phrase among physicians treating syphilis was, a night with Venus, a lifetime with Mercury. Very sad.
Great marketing. Great marketing.
The meaning is one encounter could result in syphilis. Treatment might require years of mercury exposure.
And that always, anytime I hear syphilis, it reminds me of the Tuskegee experiments that most Americans don't even know were performed.
Right.
And the government actually gave an entire community in Tuskegee, Alabama. It was classified for such a long time. And it was only in the past like 5 or 10 years that it was declassified and made public, that they had actually given syphilis to an entire community so that they could try out different treatments, but they didn't tell them that that's what they were doing. So it was done under, cloak and dagger, so to speak. It was very hidden. And there was a lot of people who lost their lives, a lot of people who were rendered infertile, and an entire community. I think that's crazy. It's a crazy thought.
It's sad. Yeah, and syphilis actually, like it develops. You develop sores, and then the sores go away, and you think you're healed, but then all the other problems show up, like blindness.
Ugh, it's terrible.
Yeah, and actually, mercury poisoning is also known as Mad Hatter disease, which means it drives people crazy.
Yeah.
The medical turning point here, this might answer your question. In 1909, German scientist Paul Ehrlich developed Salvarsan, one of the first targeted treatments for syphilis. Although not perfect, it was far safer than traditional mercury therapy. The discovery marked the beginning of the end of mercury's dominance in medicine. So it wasn't that they found mercury was dangerous, they just found a different treatment.
Well, but they know that it's dangerous because they know what chronic exposure
Now
would
they do, but I don't know if they knew back then.
Well, I guess when you close your eyes to it, maybe.
Yeah, this was in an article called Mercury, A History of Quicksilver by York Press in 1972. The author was Goldwater, L.J. Goldwater, M.D.
Crazy.
Anyways, moving on.
This was always baffling to me.
Yeah, lobotomies, the Nobel Prize mistake, historical detail. The procedure was pioneered by Portuguese neurologist Antonio Igas Moniz.
You did so good on that.
Thank you.
I would have butchered it.
Publication event, Nobel Prize in Physiology or Medicine. He was awarded the prize in 1949. I mean, chopped off part of the brain and he got a Nobel Prize.
Wow.
Reason given for the discovery of the therapeutic value of lobotomy in certain psychoses. At the time, lobotomies were viewed as one of psychiatry's greatest breakthroughs. By the 1950s, approximately 40,000 Americans had undergone lobotomy. Over 17,000 procedures were performed in England, tens of thousands more throughout Europe. Wow.
It is so barbaric. Like, I don't know how drilling a hole in someone's head.
They didn't drill a hole. They stuck a ice pick through the nose into the brain, and they would go like this, and it detached the frontal lobe from the rest of the brain.
Oh, that's terrible. That's terrible.
I happen to agree.
I can't even imagine.
The drilling hole was another one back in the
I thought
day.
that was lobotomy.
No, that was treatment for epilepsy. So when people had epilepsy, they believed there was a demon possession. So they drilled a hole in the forehead to release the demon. And actually, people who survived, they stopped being epileptic. Because even today, the last resort treatment for epilepsy is they cut the corpus callosum in the brain, which means they separate the two hemispheres of the brain, and seizures stop. So they accidentally actually were doing the right treatment, but they would take a like rusty drill, hold the patient down, and drill a hole into the forehead.
Yeah, what's funny is that is actually known as the oldest surgical procedure in human history.
Yeah,
They've actually found lots of
people with holes in their head.
And they said the medical reasons that they did that: head injury, skull fracture, severe headaches, seizures, neurologic symptoms, spiritual reasons. Remember, spirituality was woven into almost every facet of life. We've removed that in recent years. I think that's deliberate. And spiritual reasons were evil spirits, demons, curses, things of that nature. But the amazing part is that many patients actually survived that.
Yeah.
Even in with archaeologists, they've actually found skulls that show significant bone healing surrounding the opening, meaning that it was not the cause of death, which is really crazy.
To do it directly in the center, all they're going to do is separate the two hemispheres of the brain, and seizures will stop, epilepsy will stop. So anyways, that's why that's not on our list. But
it's still weird.
Thalidomide is. Remember thalidomide babies? That's a hard name, hard word to say it. Say thalidomide.
Thalidomide.
Good job. The disaster that changed drug safety. McBride, W.G. The article was called Thalidomide and Congenital Abnormalities, published in The Lancet in 1961. McBride's letter to The Lancet became one of the most influential medical warnings in history. More than 10,000 babies affected worldwide, nearly 50 countries involved. 50 countries, not centuries. 50 countries involved. Thousands born with missing limbs, shortened limbs, ear defects, organ abnormalities. You know why they gave them thalidomide?
Why?
For morning sickness.
Oh, that, yeah.
The United States largely avoided catastrophe because FDA reviewer Francis Oldham Kelsey refused to approve the drug due to insufficient safety data. Hey, the FDA did something good. Way to go.
They should have 1 or 2 wins under their belt.
They have this one. She later received the President's Award for Distinguished Federal Civilian Service. I approve that award. Good job.
So
Still,
funny.
10,000 babies were affected, born with defects.
What's funny is I was trying to look back because my mom was actually put into a situation. She was very, very sick when she was pregnant with me, and she spent the vast majority from now. Everyone's dead, so I can't confirm all of these facts, but this is what I was told when I was younger, that she spent a good 5 months or so out of her pregnancy in the hospital because she was so sick, and she kept getting dehydrated because she was throwing up so much. And so, but they had given her some anti-nausea medications, and I always thought maybe it was that, but they had stopped using that by then. But there was a combination of a few other things. Bendectin is one, which was a combination of doxylamine, which is an antihistamine, and vitamin B6, which was widely prescribed in the 70s and 80s, but it later became controversial because of lawsuits alleging birth defects. So when my mom was pregnant with me, they had given her these things, which they said you should go ahead and have an abortion because the baby won't be normal. So they were trying to talk her into having. So maybe that's, at the tail end of that.
Yeah.
Hopefully they had fully stopped giving the
Can I
the other
introduce
stuff.
something wild?
Sure.
I wrote about this in my book, actually.
Yes. Oh, I love this.
So my question is, are you telling me that the drugs caused the birth defects, or stopping the natural function of morning sickness stopped the birth defects?
Right.
Because first off, women are supposed to starve during the first trimester. They're not supposed to eat much. That's just a fact. The Dutch famine study showed that those who lived during a famine first trimester, those babies were very healthy. The ones who had famine during the second and third trimester were low birth weight.
Right.
Secondly, a lot of times the nausea is rejection of certain foods.
Mm-hmm. Yep.
And so when you block that, then the mom will eat anything she wants because she's not nauseous anymore.
Yeah.
And I wonder, I don't know if this is true, but I wonder if just that's what's causing the birth defects, because there's been multiple cases where an anti-nausea during morning sickness caused birth defects, and they all blamed it on the drug. I'm
Right.
not saying the drug is innocent. I'm
Correct.
just saying don't mess with nature. Nature says you're supposed to have morning sickness in your first trimester.
Well, I think that until we're on the other side of glory, we are definitely not going to know what the body is capable of. And it's the one process that we know the least about when it
Yeah.
comes to health. And as much as progress as they've made in fertility and things like that, I don't think we're ever going to fully know or understand what he put into place
Right.
to combat that.
Were we watching this podcast together where the guy was talking about the embryo, that it starts pulsating before the heart develops?
I don't know if I watched that with you.
Yeah,
I've watched a lot of
there
those,
was some
but-
expert. Now I want to look this up because I don't know if it's true, but it was an expert on a podcast. I have to go back and see what podcast it was, but he was saying that the pulsation of the embryo, which is basically just like the zygote, just a
Energy.
group of
Yeah.
cells, it starts to pulsate,
I believe that.
but there's no heart yet. The heart hasn't developed yet, and it starts to do that.
Yeah.
There's a heartbeat before the heart. Just like
It's probably based
in
off
creation,
of moms.
there was light before the sun and the moon were created.
Yeah. Yeah, it's so cool. Well, what's fascinating is now they've actually recorded like embryonic, like with the moment, the egg and the
Moment
and the
of
sperm.
conception.
Mhm.
Yeah.
And there is a big flash of light,
Flash of
which
light.
I go, that's so cool because
Let's-
that feels very connected
Let's
to
talk
what we
about
know.
cocaine.
Woo! What a great segue.
When the miracle drug wasn't what doctors believed. In the late 1800s, cocaine was viewed as one of the most exciting medical discoveries of the era.
I think it's funny that they use the word exciting because
It's exciting.
it's exciting.
It'll stimulate you. Derived from the South American coca plant, physicians believed it could safely treat fatigue, yes. Depression, yes. Chronic pain, oh yeah. Digestive disorders, maybe. Morphine addiction.
Which is hilarious.
That's funny. Surgical pain, yep. At
we,
the
we
time,
are not telling you to go use this for those things. Please don't.
Do not. No cocaine. It's illegal.
Hmm?
It's bad for you. Cocaine bad.
Oh, surprisingly,
Was that George Bush? Cocaine bad. He was saying something else.
come to find out though, this was funny. The biggest supporter of cocaine use was Sigmund Freud.
Wow. It was legal
Sorry,
at
I'm
the
not
time.
I'm not a huge fan of his.
Legal and widely available.
Yeah.
And
And he enthusiastically praised cocaine, describing its ability to increase energy, improve mood, reduce fatigue, and enhance mental performance. He recommended it to colleagues, friends, and patients.
wow.
But I mean, if you think about it at the time, it was a plant,
Right.
right? They probably weren't thinking of it as we do now, like a different thought process.
Yeah.
It's really crazy though.
So another physician, Carl Kohler,
There you go.
discovered in 1884 that cocaine could numb the eye. This became the first practical local anesthetic in modern medicine and revolutionized surgery. For a brief period, cocaine was hailed as a wonder drug. This is gross, but I've talked to some drug addicts who said they used to put it in their eye.
Really?
Yeah, they would pull the eyelid and pour it in the eye, in the bottom, and it would get absorbed into all the capillaries, small blood vessels.
What if you see differently?
I wouldn't know. I've never
Ever like,
tried
does
it.
that get to the blood through the blood-brain barrier faster? Is it because it's closer to the brain that, I don't know, that's weird.
I wouldn't be the right person to ask.
I'm not either, but I don't know why I have so many questions over this. That feels so weird to me.
But anyways, everyone who tried it became dependent on it. Even
That's
Freud,
surprising.
even Freud eventually distanced himself from many of his early claims after witnessing addiction and adverse outcomes in people close to him.
Can you imagine what you must carry if you were the one praising it publicly and telling all of your friends and family to use it, and then all of a sudden you start seeing, this is why we go, no, don't take that drug when it first comes out. Like, wait 5 to 10 years before you...
Don't take anything in its first 5 years of being approved by the FDA. Nothing. Wait 5 years. Minimum 5 years. No matter what the drug is. Everyone says there's no side effects. It's a perfect thing. It's amazing.
Question it.
Don't do it. Just wait. Wait 5 years. So it's funny. One of Freud's close friends, it was a physician named Ernst von Fleischl-Marxow, became addicted after Freud recommended cocaine as a treatment for morphine dependence. So the guy was addicted to morphine already. So they put him on cocaine. Instead of curing addiction, it resulted in a second addiction and severe health decline. And then there was
That's
the
okay.
Coca-Cola.
Freud would have just blamed it on his father.
When the Coca-Cola company introduced Coca-Cola in 1886, the original formula contained extract from coca leaves and small amounts of cocaine. By approximately 1903, cocaine had been removed from the drink as concerns about safety grew.
That was not that long ago, people.
No, it was like 123 years ago.
So crazy.
Yeah. Anyways, what else? These are just references. Moving on. How about penicillin? This is my favorite discovery in history. Is penicillin. The greatest accident in medical history. Original discovery was Alexander Fleming, published British Journal of Experimental Pathology. Title of the article was On the Antibacterial Action of Cultures of a Penicillium, published in 1929. Before I give you fun facts, we're going to take an ad break, so make sure you stick around. We're going to talk about penicillin. So Fleming's discovery sat largely ignored for nearly a decade. It was not until the work of Howard Florey, Ernst Boris Chain, during World War II that penicillin became a practical medicine. And they won a Nobel Prize. All three scientists won the Nobel Prize in 1945.
Now, was this the first antibiotic?
Yes. I believe it was, and it's basically fungus. What they did was, and I wish we had more information on this, you may want to look it up, is the way penicillin was discovered was they didn't clean their lab, and fungus grew. And then they found that fungus was destroying the deadly bacteria. So they made it an antibiotic. So it was completely by accident.
Mm-hmm. Yeah, it said that before antibiotics, people routinely died from things that seem minor today: strep throat, pneumonia, infected cuts, childbirth infections, dental infections. Even a scraped knee could become a life-threatening event. In the early 1900s, infectious diseases was one of the leading causes of death. So let's see. Yeah, it says he returned from vacation and began cleaning up petri dishes that contained Staphylococcus bacteria. Most scientists would have thrown that contaminated dish away, but Fleming noticed something strange. One petri dish had been contaminated with mold. Normally, that's bad science, but around the mold, there was a clear ring where the bacteria had died. The bacteria were growing everywhere else, but not near the mold. Fleming immediately recognized that the mold was producing something that killed bacteria. The mold was later identified as Penicillium notatum, hence the name penicillin. So that's pretty cool. Here's one of his quotes.
That's why we don't need to clean as much as we do.
Well,
let the mold grow.
Let the mold grow. I'm pretty sure that's a...
Never mind.
Yeah.
No.
Yes.
That's not
it's
appropriate
not.
in any way, shape, or form. And so...
that's fascinating.
Yeah. Now, we were going to talk about useless organs, but not the organ you play like a piano. We're talking about organs in the body. like the
Now we feel there are no useless organs.
appendix and tonsils and all of that. However, why don't we save that for another podcast, because I don't want to shortchange it, because I do, especially appendix. I have a good story about the appendix that I heard from a surgeon. So why don't we save that and see if we want to bring out our guest? So you ready to bring out the guest? Why don't you snap your finger, see if he'll appear? Wow. It actually worked.
I wish all my kids came out that easily.
Well, yeah, I mean, yeah, exactly. Saves you a lot of.
We have two visitors.
Yeah, we have a dog.
We have a 4-legged visitor today who's probably going to come around and give Sean a hard time or look out the window. And then we have our youngest, Cyrus, who came with us today.
How's it going, buddy?
Good, how are you?
Oh,
Good.
you got to talk into the mic.
Good.
All right. So we're going to ask you some questions. So do you know that there was a lab where they were doing experiments on bacteria? Do you know what bacteria are?
Yeah.
Okay. Are they good or bad?
Bad.
Actually, some are good, some are bad. Did you know that?
Yeah.
Some bacteria are actually good for you. All right. So in a lab, the guy was studying bacteria and he didn't clean his lab very well. So mold started to grow. And then he started giving that mold to people to eat. So, and that mold is now known as penicillin.
Oh.
So it was actually a good discovery, right? Because penicillin
Yeah.
is an antibiotic that kills bacteria that causes sore throats.
Yeah.
Have you ever had a sore throat?
Yeah.
You've never had antibiotics, though.
I don't know
Only
if I
for an outer ear infection.
Oh, but that was a drop, right? He was putting
He's
drops.
never had anything internally.
Yeah, you never had an
by
inner
mouth.
ear infection, otitis media. You've never had the classic type of ear infection. But the outside, that happens from dirt. Like something gets dirty and then the skin of the ear gets infected. Well, anyways, that's that. What else? You want to?
So I want to ask him a few questions
Do
and
it.
see what he thinks over some of the topics that we did today, because some of these are kind of weird, and I want to know if you think they're weird or if you think that it's like okay. So how about there's something called bloodletting that we talked about, where doctors used to drain the blood out of people to cure fevers. So would you A, trust a doctor that did that, or B, run away?
definitely be.
B, run away?
Yeah.
Okay. How much money would somebody have to pay to let them try that on you?
10 trillion.
10 trillion. Okay, you heard it here first.
You know, Elon Musk is worth over $1 trillion right now.
Yeah.
1.3 trillion.
Yeah, it's crazy.
He's 4 times richer than the next richest person in the world.
That's wild.
Moving on.
Leeches. Do you know what a leech is?
Yeah.
What's that?
They live in the water and they latch onto your skin and suck your blood.
Yeah, pretty gross. Doctors used to put leeches on people to suck blood. How many leeches would it take before you quit the appointment?
1.
1 leech? Yeah, I think they just have to walk in the room with it for me. Let's see. Trepanation, hole in the head. Doctors used to drill holes in people's skulls to treat headaches and other illnesses. If a doctor said, "Good news, I know how to fix your headache," and then pulled out a drill, what would you do?
I'd run away.
What do you think is a good way to take care of a headache?
Probably just rest.
Rest? There might be one other thing that your
Take-
dad does.
Take supplements.
Take supplements? How about get adjusted?
Oh yeah, get adjusted.
Okay, you know what mercury is?
Which one? The planet?
No, not the planet.
No, I don't know.
Do you want to explain? It's a chemical.
It's an element in the periodic table. It's a metal. It's a liquid metal. So it's liquid at room temperature. So it's kind of cool. Actually, kids used to play with it because it's so cool. Because you put a drop of it on the table, you can tap it and it just rolls because it's liquid. But it's metal. And but it's toxic. But people didn't know it was toxic.
So doctors
And it's used in thermometers.
Yeah.
So it's in the bottom of a thermometer, and when it heats up, it expands, and it tells you how many temperatures, what degree of temperature you're at.
So, knowing that it's pretty toxic, and you probably shouldn't even play with it, let alone put it in your body. If a doctor wanted to give you mercury to get better from something, I know, I think that too. Would you rather drink mercury or eat broccoli every day for 1 year?
Eat broccoli. I love broccoli.
He's the only child that loves broccoli, but we'll take that. And then I think one
He got
more.
that from me.
Doctors used to put a tool behind people's eyeballs to fix depression. I know. On a scale of 1 to 10, how bad of an idea do you think that is?
Like one.
1 being a good idea, 10 being the worst idea.
Can you
can
define
imagine.
behind the eyeball? Like, how'd they get back there?
Well, that's the lobotomy. So
Oh.
it's probably what
Oh,
you
yeah.
said.
So it's an ice pick, buddy. They would stick an ice pick in the nose, go into the brain, and cut part of the brain.
That's a 10. That's a bad idea.
That's a bad idea
Terribly
for sure.
bad idea.
I'm impressed that you know so much, because I agree with all that.
Here's a fun one, and maybe we'll leave it at this. Last question. Maggot theory. Do you know what a maggot is?
No. Well, no, but I forgot.
It's a kind of worm that you usually find on like dead bodies or dead animals. They like eat carcasses. They're pretty gross.
They're white and they're chubby.
Chubby worm. So doctors sometimes use maggots to clean wounds. Would you rather have maggots help you clean the wound or have a giant spider help you clean the wound?
Did you watch the movie Gladiator?
No, I didn't.
You remember Gladiator, right? In the beginning of the movie, he has that cut,
Mm-hmm.
and he wakes up when like a indigenous tribe of people that are helping him.
Right.
There's maggots in the wound.
Yeah. Eating all the dead skin.
I guess
and
so.
Flesh.
Yeah.
So, maggots or spiders?
I have to go with maggots.
He really doesn't love spiders, so I was very interested to see what his answer would be. All right. Well, I think you did a great job on some of those questions. I think you were spot on. I wonder what we'll find out years from now that we're doing that people think is weird down the road.
You got any ideas?
No, not really.
We were talking about that earlier. You couldn't think of anything.
Yeah. Well, I wonder if some of the routine surgeries will be outlawed, like when they take people's tonsils out or they take their gallbladder out, or
Yeah. Maybe.
there's some surgeries.
Wow.
Hapu is upset about all of that. Come here, Hapu. Come here.
Boy, well, I was saying, I think we've had a very unique podcast today with special guests that we've had, and you did a great job on your question and answer session. Thank you for coming on and doing that with us.
Thank you for letting me on.
Anytime, sir. We'd love to have you again.
Thanks.
Maybe one day you'll discover something and come and present it on the podcast.
Yeah.
That'd be good.
Yeah.
Awesome.
All right. Thanks. Thanks, everybody. Enjoy the rest of your week, and we will see you next week. We will have our official guest here next time.
Yes. So come back and join in. We're going to be talking about how the body holds trauma. So it's going to be a little bit different than some of the topics we've covered in the past, but I think it'll definitely be something that you'll want to tune in for. I think the vast majority of people either have experienced trauma themselves or know someone in their close circle of influence who has experienced that. See you next time.
Live radio, local podcasts, the Frederick Podcast Network at listenfrederick.com.